History. Why do some COVID-19 patients have lingering symptoms long after they first contracted the virus?
As WMTW News 8's Jim Keithley shows us, there's a nationwide study underway and the researchers need your help.
The National Institutes of Health currently undertaking 80 studies in 30 different states, Maine being one of them. They're trying to figure out why some people have long COVID symptoms.
Calling all volunteers. If you've had COVID, maybe you haven't, whether you're still experiencing fatigue, cough, body aches and pains, brain fog, all symptoms of long COVID, and doctors with the NIH are determined to figure out why.
I've heard patients say they forgot how to sleep. They lie in bed, they can't sleep at all.
They need 17,000 volunteers across the country. So far, only 3,000 have signed up. Medical experts want to follow those patients over a 4-year period with the goal of trying to figure out why some people get long-term COVID and why others don't, and how they can treat it. The Maine Medical Research Institute is among those centers working with the NIH. Dr. Walter Korasev is one of the 2 directors of the National Institutes of Health leading up these studies.
So you can compare what's different about people who are having persistent symptoms versus those people who made a complete recovery.
As they follow these patients, doctors hope to learn more. All they can go on at the moment is this.
Some people may have persistent virus particles stimulate the immune system. Some people may have their immune system upset by the infection. Some people may have autoimmune where their immune system's reacting against their own body after it got souped up by the COVID infection. But those are the main culprits, but we don't really know what is causing the trouble.
If you're interested in learning more about being part of this study, you can learn more by going to recovercovid.org. In Scarborough, Jim Keithley, WMTW News 8.